welcome to Conversations with AcroPsych, where we create educational and inspiring material on psychiatry and addiction. I'm your host, Dr. Matt Campbell, and today I'm thrilled to be joined by Angie Scott. Angie is a mental health counselor. She's an experienced therapist that also trains other therapists at We the Villages to provide CRAFT therapy. CRAFT stands for Community, Reinforcement, and Family Training, and is the premier evidence-based treatment to help someone when they have a loved one, a person in their life, like a spouse, a child, a close friend, who's struggling with a substance use disorder and not active in treatment. So Angie, welcome to the show.
Thank you. I'm so excited to be here.
I realize I was just given a brief blurb on what CRAFT is, but for many audience members, I'm sure this is the first time they're hearing of it. Do you mind sharing with them what is CRAFT?
Absolutely. So as you mentioned, it's the leading evidence-based approach to working with people who are concerned about a loved one's substance use disorder. So a little bit different in the fact that sometimes when we think about addiction treatment, we think of only the services provided to the person who's experiencing the substance use disorder. And CRAFT is really focused on the people around that person that's using substances that are concerned about them. As you mentioned, it's an evidence-based approach. And so CRAFT has been studied for a long time. It's got an impressive evidence base behind it. It really is focused on three main goals. It aims to reduce harmful substance use, have the person who's using substances engage in some form of treatment, and improve the overall well-being and functioning of the family member who's concerned. And so what we know from practice and from experience is that when you are supporting or loving someone who's experiencing substance use disorder, it's not uncommon that you're also experiencing high rates of isolation or higher symptoms of anxiety or depression or physical health concerns. And so that is why one of CRAFT's goals is to really make sure that the people who are concerned about their loved one are taking care of themselves as well.
I can very vividly remember when I was working on inpatient psych unit, a lot of people come in, there's psychiatric problems, but there's also substance use problem. And they're not always motivated for treatment at that time, but I would get tons of calls. I would talk to family members and they'd be so concerned. And there's always this feeling of like, there's nothing out there. There's no material. If they've heard of anything, it's maybe Al-Anon. Can you speak to what maybe a psychiatrist could tell that person about CRAFT as far as how this is something that is available to them in that kind of moment?
Yeah. Well, you're absolutely right. I think if you were to Google right now, supporting a loved one with addiction, some of the first results that you would come across would be treatment centers. And it's a really great resource. But a lot of times families aren't even there yet. Like, how do I even have the conversation about entering treatment? I'm just not there. I'm just in the midst of my day-to-day struggles. So that feels like a big leap. And so I think families should really understand about CRAFT is that we're certainly not saying that loved ones are responsible for their family member's substance use disorder. But we do know that family members are often really highly motivated. And so they are seeing the substance use from a completely different perspective than the person who's using substances. They're seeing all of the negative impacts and none of the positives. And so that really increases their motivation to engage in treatment. And CRAFT it's a behavioral based approach. And so we teach family members and other concerned significant others, we call them CSOs, but we teach CSOs skills to help them modify their behavior to increase positive pro-social abstinent behaviors or less substance use. And so we really want to help them change so that they're interacting with their loved one in a way that could motivate their loved one to accept some form of treatment. Now, there's lots of skills in between, but that's one of the ultimate goals.
That's such a powerful thing for them to then be able to do. Have you had examples of working with someone who, their loved one's been refusing treatment for a long time, that after they actually went through CRAFT, that things changed for them?
Yeah. I mean, CRAFT has really been studied with people who have previously been resistant to treatment. So not people necessarily in the clinical trials that have studied CRAFT's effectiveness, not necessarily people that are saying, yes, I have a problem, I need help, but rather people that have said, I'm doing just fine. And so it really does work with changing the motivation. So moving somebody from feeling like I don't have a problem or this is all under control to getting them to want to seek treatment and want to engage in some form of support. And I think it's important to note too that when we say treatment in a conversation like this, that might bring up very specific images for folks about what we're talking about. And using the CRAFT approach, we really think about treatment as a broad range of options that meets the individual where they're at. And so a first attempt at treatment might not be the last or only form of treatment that we see families get to, but any attempt to change and modify that behavior is seen as a huge success. So lots of times we see families go through the process and they'll add something to their loved one's support system. And then that's the first step in a process that increases that behavior as time goes forward.
Sometimes we get very narrow in our focus of what success is, and when that happens, it can be so demoralizing or defeating when we're not getting there. But change, it takes time, and giving like practical steps along the way that make such a meaningful impact is really, I'm sure, cool to see when you're able to help people recognize what they're achieving.
Yeah, absolutely. And I think it's empowering, right? You mentioned in the beginning that sometimes people only know of one option that for family members that are concerned about a loved one. And I think craft to me is really an empowering approach. There are things that you can do to help your family member do better.
What would it actually look like for that family member when they come to you? What kind of work would they be doing? How long would it be lasting? What would be some kind of outcomes that they would be trying to achieve?
Well, so We the Village has an online component to our craft program, which is really wonderful because it means that we're able to meet families where they're at and also for different learning styles and the way that they feel they would best like to engage with this type of content. So when people go to our website, they're shown three options for We the Village programs. And so the first is an online component where they just learn the craft skills. There's short videos, there's worksheets, so they can figure out how might I try this with my loved one. And they can do it at their own pace, which each week they get a different lesson or skill that they can focus on and enjoy at home. Everyone that comes to We the Village is able to do an introduction call. So if they have questions about, is craft the right fit for me? Will this work with my loved one given our history or given their prior experiences? We do free introduction calls so that we can really find out, what their needs are and what program actually will work best for them given where they're at. And then we have small group programs and individual coaching that also can span 12 weeks that focus on a different craft skill each week. And the group coaching allows us to come together in small groups, which we know can be very healing to be in community with people that understand our experiences. And then in our individual programs, we're able to really drill down. Let's get very specific about how you want to implement craft at your house, given your situation, because craft is beautiful in that it's a protocol that there's 9 core procedures. You can use it in multiple different relationships, different substance types. And there's going to be modifications that you can make. And so what the skills look like in one family might be a little bit different for the next. And so our individual coaching really allows us to look at the very specific details of how someone might implement craft at home. And then week to week, we're touching in. So what did we learn? What did we learn from it last week? And what do we want to modify? How do we want to change this? Or did that feel like, okay, this is the right path. Let's keep going in that area and let's add in a new skill this week so we can ramp it up even more.
So there's a lot of flexibility. Then that person would have the option of self-study, basically online modules, their own kind of worksheets, group work, or an individual therapist.
Yes, exactly. And all of those come with the online component. So there is always a little bit of, learning the content on your own, which I think is really nice for lots of learning styles. I can sit with the material. We have worksheets that you can print or save and really figure out, okay, I want to try this week. What is this going to look like? And then, 2 of our programs offer feedback and coaching, which can be just take it to the next level.
Very cool. You mentioned that they're going to go through, then it's a skills-based thing. They're going to go through these 9 core skills. What are those 9 skills that they would be learning?
Yeah. So it's based on positive reinforcement. So the first session is called a motivational induction. It's really just, here's what craft is. We're going to tell you a little bit about the evidence base. We're going to tell you what you can expect out of it. I also want to note, this is where we really say, yes, we're asking you, loved one, to make some changes in your behavior, but you are not responsible for your loved one's substance use. So it's a really important part. And we're always going to be talking about safety and making sure that anytime we're making changes to our behavior, we're doing so in a way that feels safe. And then we'll talk about things like positive communication. We do a functional analysis or called a roadmap, which helps family members look at the substance use and what needs it's meeting for the loved one so they can really gain understanding of how can we compete with some of the benefits that your loved one is experiencing from the substance use, which might sound really off the wall for people at first, but they really are. The substance use is meeting a need. So let's talk about what need that's meeting and how we can meet that need in other, maybe more pro-social behaviors. We talk about positive reinforcement and then withdrawing rewards. So that's how we really influence. How do we make the non-using time really joyful and full of life and really rewarding? And then the using time less so that we can work on the motivation piece. We talk about natural consequences. And so helping family find out what feels right in terms of what's the right amount of consequence to allow my loved one to experience without me intervening, and making sure that's a very individual approach and that feels really comfortable for everyone. And then we talk about treatment entry. Of course, we spent two of our sessions on treatment entry, talking about treatment options, but also how to have that conversation so that you're heard and so that we can increase the likelihood that your loved one will say yes. And then we've added on, that kind of covers a lot of the core craft procedures. And the Village has added on some content on improving positive progress, which is just a really wonderful approach to let's give more positivity and more activities that bring joy into your loved one's life, and relapse and recovery. So that if a slip or return to use does have our family members feel like they're able to deal with it, they can manage their own stress and anxiety about the potential that a relapse or return to use could happen. Um, and they are able to have conversations openly with their loved one about it.
And that is a lot of skills for a person to learn. I imagine that takes some time and some practice to get all of those down.
Yeah, that's it. And that's exactly why we pace it out. So our programs are based on kind of the weekly model so that it's not overwhelmed. It's like, okay, we're going to ease you in. Let's talk about what craft is, what you can expect here. And then let's talk about communication. And so we really want to avoid the feeling of, oh gosh, I have to completely change my life. And I will say a lot of these things are very intuitive. And what we find is family members are doing some aspect of craft a lot of the time anyway. So it's really looking at, oh, how can we tweak these behaviors so that they're super consistent, so that the association is strengthened for your loved one, that, when I'm not using, I'm getting all of these great benefits with my family. And when I am using, I'm not. And all just making tweaks to things. So it's not like a whole overhaul. There's a lot of content, but it really is just figuring out, let's be consistent and make it most effective for you.
Some people wonder, I'm a parent. Does this work for me, or does this have to be a spouse that can actually affect the substance use disorder?
Yeah, I think that's a really great question, because we get it quite a bit, right? I don't live with my loved one. Am I still able to do craft? It's a teenager and he's using cannabis. Is this still appropriate? And I really do think that is part of the beauty of craft, is that it can be really applied to multiple different situations. It's been studied in different relationships and with different substances, but also we at the Village do it with, can implement in a multitude of different settings, including, they live in different states, but they're still having regular contact. Siblings have been successful in getting and using craft for their family members. So we really have seen it to be effective in multiple different relationships. The skills themselves are easily transferable. It's just that's where we look to modify and make things really work depending on your unique situation.
So the craft, it's helpful for other types of relationships, for parents, for spouse, for siblings, for close contacts, even if you don't live in the same place. And it sounds like for, multiple substances. It doesn't have to be alcohol. It can be cannabis, it can be alcohol, it can be opioids, it can be meth, really any substance use that they're trying to address.
Absolutely. Yeah. Our research study through NIDA was specifically opiate use disorders, but primarily, that's not what we see most of in our practice. I think right now, we're seeing a large uptick in parents who are concerned about their either adolescent or young adult children's uses of cannabis. And so we've seen success in all of those populations.
Someone that's in this kind of situation, like a spouse is using a substance, try one thing, but you don't necessarily see the result. And then you try something else and you feel kind of hopeless and you don't have a framework to think about, okay, what do I need to just keep doing consistently, give it some time? What am I doing right already? And I can keep doing. So I imagine that's really helpful for them to hear of these are the areas that you already have it down. These are the areas that's going to just take some continual practice and see it in that kind of way.
Yeah. And also what's hard about this? Right? What is hard about being consistent with drawing attention when your loved one is using, right? What makes it challenging for you to do that consistently every time? And that might just be, well, it feels mean. it feels mean. And so let's reframe that and consider that, by you taking time to take care of yourself when your loved one is using, you're allowing you to model really good self-care for your loved one, and you're adding more meaning to the time when they're not using. And so some of it is just reframing and kind of exploring some of maybe the discomfort around how to interact with their loved one, because I think there's a lot of uncertainty around what's the right quote unquote thing to do here.
I could see that. If we can try to do a specific example, you mentioned one of the skills being communication. And I think anyone and everyone can improve in communication. So could we try where I'm actually the person trying to improve my communication to my wife? I'm newly married, so I'm sure she would appreciate this too. One thing that she does a lot more of in the household is she takes on the responsibility of laundry a lot of times. So it's something that I appreciate. She does a lot more than I do. And she also will frequently, when she finishes it, dump it on the bed, knowing that I'm usually the first person to bed. And so I will then have to pick it all up and I'll get to fold. So I'll participate and help out a little bit before I go to bed. But then I usually see it when I'm tired, I've had enough for the day, I'm not in the mood for it. It would be great if it was dumped somewhere else, that I saw it, dealt with it earlier in the day, as opposed to on the bed. How would I start this with you?
So there are 7 kind of tenets for positive communication. So one of them is to be brief. So not rehashing a year's worth of laundry tales. The second is be specific. So being very clear about, what you're hoping to accomplish. The third is to be positive. And so that doesn't mean we only talk about positive things, but what that does mean is frame your request in a positive way. A tweak here might be, instead of, I don't want you to put the laundry on the bed anymore, it might be, I would love it if you could put the laundry in this room and I'll get to it before I go to bed. So you're asking very specifically for the behavior that you want to see more of, as opposed to what you don't want to see. Some other kind of components of positive communication are to use an understanding statement. What could be a way that you could convey your understanding as to why that this is a strategy that she's using right now?
I think the understanding would be that I really appreciate all of the effort you do to take care of the laundry, and I'm sure you want me to also help contribute to the laundry.
Yeah, I understand I could do more to help with the laundry, and you would appreciate that support. Absolutely. Another one is a feeling statement. So something that can be, I feel grateful that you do this for our family and for our household. It really means a lot. But a feeling statement, especially when we're talking about addiction, can be really helpful to remind the both people that there are 2 people impacted by the situation. And then the next one is one of my favorites and can be one of the trickiest, which is to accept partial responsibility. And so what that means is you're not saying, I'm solely responsible for the amount of laundry that our household is doing, but taking your part in it. What are you responsible for in this situation? And that could be, I know that I don't help out with the earlier stages of the laundry, and it's really helpful for me to put it away. So this just allows the person to understand that nobody is 100% to blame here. Is there any part of this situation that I can take ownership of?
Throwing it on the floor, probably not the best. Of ignoring it or saying like, stop doing that. I really hate when you do that. Those instincts probably not going to get us what we're looking for. But if I'm able to understand that I could do more, take some partial responsibility of where I could do more. And I think you mentioned that brief and positive. Maybe asking her if she could put it in an area that will help me then do it earlier in the day so it gets taken care of. Something like
Yep,
that.
exactly. So the last one actually is to either make an offer or to make a request. And so it could be, I really want to help you do the laundry, and it would be helpful for me if we could just do it in this other room so that it's not the last thing that I do at the end of the day. I'd love to do it, before dinner. Would it be possible to put it in this other space and I can do it at 6 p.m. instead of
Well, I
10?
know that that's going to be helpful for me. I'm sure my wife will appreciate the advice there. I could also imagine where a ripple like that happens in a relationship where you start having these different kinds of communications that it really can improve the overall relationship and some of the problems that are feeding the substance use.
Yeah, absolutely. And I think so it's useful for every conversation. And I should note, it's a framework. We don't say you have to use all of these skills in every conversation, but just as a kind of a lens to run whatever you're wanting to bring up through that framework can be really helpful because, when we're talking about something that can be as heavy or emotional as substance use disorder in a household or a family, there's a lot of hurt oftentimes that comes into it. And so by being really brief and being really specific, we're helping to set our loved one up for success and really be able to meet our needs and our requests. And also, you know, reducing the likelihood that they just shut down. Because if
Mm.
I'm a person, you can imagine being a person who's using substances, and you've heard this a million times. What's new? What we've had this conversation, and I know that you're concerned about my use. And so I think that the framework really helps people say what's most important here. And when we get to the point of we're going to make an ask or an offer to help, that's really important because that's how we can convey our needs in a way that's not all about, we're not building on blame and shame. We're taking partial ownership. We're acknowledging why this might be happening. Nobody's really, it's not about repeating this pattern of pointing fingers, but really let's get to a solution because there is an issue here.
Working on it and like practicing it actually with you would be a really benefit of learning the skill. Like I think that there's some utility in being able to learn something as a self-study, but having that experience of actually practicing, is that part of the therapy when they're one-on-one is actually practicing these skills?
Yeah, absolutely. And even in group settings, we'll get the brave group participant that will say, I'll do a role play. And sometimes, I'll do the hard part first. I'll model it first so that people can get a sense of, what this might look like. And it's not about perfection, but you're right. I mean, when we're going into a conversation, if we can have an idea of what we want to say and how we want to say it, that preparation can take away so much of the anxiety from it. And so many times people are like, they come back and they say, oh, it went so much better than I could have imagined. That was so helpful to practice. And so there is definitely resistance to it, but it is a skill that can be so, so helpful.
It's got to be really rewarding when they see that turn for the first time, some sort of pattern that's been broken.
Yeah.
I imagine there's a few barriers that come up for someone, a concerned significant other, going into these interactions and trying to navigate. I imagine anger is a big one. I wonder if sometimes even like a feeling of helplessness or not really being able to make a difference, like their own sense of agency. Can you speak to what kind of challenges come up for people that they're trying to navigate as they're doing this change?
I think one is just a real sense of urgency. You're seeing somebody engage in harmful substance use, and that is scary. They're doing things that they wouldn't normally. They're potentially putting themselves in an unsafe situation. And so part of it is, our knee-jerk reaction, and we have to fix this right now. And so I think part of acknowledging, yes, this is urgent, and let's be prepared for this conversation anyway, because in the moment, you might say, you need to get help. And while that might ultimately be the underlying message that you want to convey, the likelihood of that being the message that they say, yeah, you're right, let's go, is very low because they've heard that before. And so helping concerned significant others to really recognize, let's have the conversation at a time that they're most likely to be receptive. So we do work around, we want people to, ideally, they're in a good mood. They're not, miserable. They're not oozing. They're not hungover unless that hangover is one where they're maybe feeling a little bit remorseful and they might be receptive to hearing. So we help concerned significant others identify times when their loved one might be more receptive to having those difficult conversations. And then also sometimes I think it's just as simple as what actually needs to be communicated here. Oftentimes it feels like a very big issue, but it comes down to one little point. And so it might be anger, it might be hurt, but really piecing out what's most important that they communicate, and we can get them to feel confident to have that part of the conversation and know that you're not going to talk about everything that's a problem right now.
I mean, like you said, these things are urgent. These things are potentially life-threatening, and they're at this place where everything needs to be taken care of. But at the same time, there's a foundation that needs to be built to really do it effectively and successfully. And we talk about how recovery is a slower process. It's not something that, one medication, as much as we would like, can just solve everything, or other quick fixes. How do you balance that feeling for yourself as a therapist of, like, I'm worried, I want things to get addressed, but at the same time, we have to do it in a way that's going to be effective?
Yeah. Well, one of the things when we do individual coaching with clients, I think that that's one of the biggest advantages is that we're able to be flexible. And so if they come in and they say, this thing happened over the weekend, I really need to talk about treatment, we can go to treatment and we can, put everything else on hold and help them feel like, okay, we've got a plan for how you're going to have the conversation about treatment and some options so that you're not going in and just saying, we have to do something different. You're going in and saying, I'm really concerned about you. Here are the things that I've noticed, or here's what happened this weekend. And I'm wondering if you would be open to having a phone call with this provider, or, we could do an intake with this other provider, and giving options and a concrete kind of plan. You're right, because sometimes the urgency is very real and we do have to kind of go where the family needs us to go. And so that's an advantage, I think, of working individually, is that we can talk about treatment entry right at the very beginning. And then maybe they don't end up having that conversation for 3 weeks, but they already know what they're going to say when they're ready.
That makes such a difference. Even if they don't get all of the skills, they don't have all of the practice, to have that really difficult conversation with some preparation in a way that is much more likely to help.
I think being prepared for that conversation is so huge, because it does help lessen the anxiety for the concerned significant other. They have a plan. They've got options. They've got something that their loved one can respond to. Part of the work of craft is, let's think about what are available options when you're not in crisis. And we can have those prepared and be ready, and you can feel armed with the knowledge and information that you need to bring it up when the time comes. And so sometimes that comes very naturally, and you're just prepared and you're ready. And that can be really, really helpful.
I'm wondering if you could give a case story of someone who's worked with you so our audience can get an idea of more of like what they came in with and what the outcome was than like the whole process along the way, just so that people can kind of put an actual story to what they're seeing when we talk about these very, science-based outcomes, giving the actual story version of that.
Yeah. Can I give two short ones?
Yeah, absolutely.
I'm going to bend the rules a little bit, but here's why. Because I mentioned that the craft is something that's so easily adaptable, but I really want people listening to understand how it could work for them, and some of the differences. So, and how we might apply it differently based on their needs. And so one family member that I'm working with is a spouse who is concerned about her husband's substance use, and he's been drinking for a long time. They're at a place where they're not having a lot of conversations about it, because she's kind of backed off and feeling a bit like, I don't know what I can even do here. And so they're not having a lot of conversations about drinking, and the resentments are kind of building because, she's worried that it's just going to create a fight. And so the dynamics there are, she wants some support for him, but doesn't even know how to talk about drinking. For her case, it looks like we're going to start with positive communication, but talking about something that's not alcohol related. So maybe we start with some of the impacts of use. And so maybe we're starting with the behaviors of, here's what I'm seeing, which is, you weren't able to help with bath time last night for the kids because you were already in the basement, out, and they asked about you. And so not necessarily attacking the drinking behavior, but attacking the effects of it, and really addressing that in a way that she felt more comfortable with, rather than just saying, I want you to get help for drinking. Then we go into self-care, because she's feeling really burnt out and feeling like, I don't know, I'm losing myself in this relationship. And when we talk about positive reinforcement, it's really difficult to try and reinforce basic behaviors that you expect from a partner. And so we're talking about, okay, what can positive reinforcement really look like in a way that feels manageable to you, that's not adding something else to your plate because you're already stretched so thin, but how can you acknowledge, when he does come up for bath time, and just acknowledge in the moment, it was really nice to have that extra set of hands last night. It went so smooth. Thank you so much for doing that, in a way that feels really good to everyone. So that change for her, the conversations were very different. Then we build that skill to be able to then talk about these behaviors that I'm seeing, missing out on family events, not being present for the kids. I'm really noticing that it is around times when you're drinking more. And I wonder if you'd be willing to talk to your doctor about it. So this spouse was really adamant that therapy was not going to be an option. It didn't feel like a more long-term treatment program would be agreeable either. And so the first step was the primary care physician, getting that appointment scheduled, having that conversation. And that's where we start. And that's how we walked through the craft protocol with her. There is a family member or parents who are concerned about their young adult child's opiate use. They've had multiple attempts at treatment in the past. They've done an intervention and really feel like that was almost harmful to their relationship and their connection. And now they come to We the Village, and they're wanting to do craft because obviously they want help for their son and they want to try something different. So when we start with positive communication in this family, really looking at, can we take a step back from talking about substances for a little bit? Because it's been the main focus of the relationship for so long. Can we just take a minute to build the connection again? And maybe that feels scary. So let's explore why that might feel scary. But is there an opportunity to expand the relationship to include some other things that can add meaning and value to both of your lives and build that connection so that as we get to a place where we're talking about treatment, it's better, it's, going to be received a little bit better and talking about, are there behaviors that you're doing right now that could be intentionally supporting use? And are there modifications to those behaviors that we can make together? And so that family came and said, we absolutely do not want our child to be homeless. Are you ever going to say that we have to do that? And I think the beauty in the craft approach is that absolutely not. You get to decide if that is a hard line for you or if that is something that we want to talk about down the road. And so you get to guide ultimately what consequences your loved one will face to some degree, obviously, that are within your control. And you get to tell me where we go. And then we look at the situation and say, okay, so being unhoused is not an option for your child. Are there other consequences that you might be shielding them from that we could stop doing and see? Because ultimately we're trying to reinforce the positive behavior, take the reinforcement away from substance using, and let them feel some of the effects of their substance use. And so in that instance, it was waking them up for appointments, calling to wake them up to make sure they got to appointments. And so what happens if we stop that? And they were able to do that. It increases a little of the discomfort and it opened an avenue to have a conversation about an additional form of treatment because now there was this effect on their life that they were missing appointments and they weren't as functional, and it made it easier to have a conversation about substance use and support systems that could be put in place.
So two very different examples, but very effective examples of working with someone and really seeing a transformation.
And sometimes it might feel slow, right? When you're like, oh, primary care physician, that's not where we want to end up. But we learn so much from that. We learn about, what are their preferences. And I think it's really important that we're talking about someone who, yes, is using substances, but they're also a whole human being. So if they're saying, my biggest issue is anxiety or stress, my biggest issue is I'm not sleeping well, let's start there. Let's start there and see what we can put into place and add to that care team, add to that support system that, ultimately can open up the door to other people having conversations about their substance use. That's not just the person that's doing craft treatment.
I'm glad you mentioned too, it's a step, because I'm thinking of myself as an addiction psychiatrist. And I think sometimes then I could see people being like, they saw the addiction psychiatrist, everything is going to be smooth sailing from here. And there's many instances where that's obviously unfortunately not the case, but I can think of one specific for myself that I had that he's got to be in his 50s. Like, he's an older gentleman, very successful financially and career-wise, very severe drinking problem. And the first thing he says when he comes to me is, I'm not going to inpatient rehab. The wall is up. I'm taking this step though, and I'm going to trust you and I'm going to talk to you. And I very much am not going to get him to go to inpatient treatment right away, but I also recognize I'm going to meet him where he's at. And if we're not effective, we may need to reconsider that option. Right now, we're not going to inpatient. After a few months of him seeing that he was really not going in a good direction, he was willing to take that step. And I think there was enough trust with me that I was willing to hear him, his values, what he cares about. And then he got there. And so I think it's always really valuable to hear that the first step or the big step, even inpatient rehab, it doesn't mean that everything is solved at that point. But these are markers of really moving the needle and moving in the right direction.
I think it's so true. And to just acknowledge that those barriers are present goes a long way. Like, we can work with that. We can learn. And I think learning from attempts to change their behavior with youth is really powerful information. And that's what we tell loved ones. Nothing is an effort wasted. We can learn from this. And it's just how we use that information to shape what comes next.
Yeah. See frequently that when I'm trying to work with that approach and helping people, see the setbacks or the challenges in that way, a lot of times the person with the substance use problem, there's a lot of shame. And it can be very, very difficult for them to have the kind of compassion for themselves to really look at it. Do you notice similar problems come up with family members when you're trying to work with them around changing that approach to really being more open, compassionate about the things that aren't working?
I think a part of our work there is to acknowledge that it happens. There are returns to use. It can very well be a very common part of recovery. For for loved ones, I think there's such anxiety around what if that happens. And so part of our work is to acknowledge that, yeah, you are going to feel nervous. You are going to feel worried, but let's put it into perspective, right? We can look at a slip or return to use in a number of different ways. And so like, let's ask ourselves, what do we actually know to be true in this situation? How risky was it? How long has it lasted? Are you able to talk about it? And so part of our planning is, helping loved ones feel like, I know that last time this happened, here are some of the things that I saw. How can I ask my loved one that I want to check in with them if I'm starting to see those behaviors so that we can even intervene earlier? And I think when people approach it with such compassion, it really helps to mitigate some of the shame. If we can just talk about it as, I don't expect that you're going to have a slip or a return to use, but if you do, I want to be prepared. And I would love to be able to talk to you if I'm noticing some signs that I saw last time. How would you feel comfortable when you're approaching that conversation with you so that, if something isn't working, we can troubleshoot together because I really want to be a part of your team.
Even after the person with the substance use goes into treatment, the family member who's working with you, they can still work with you. There's still ongoing treatment that they can have in those instances. Am I hearing that correct?
Yeah, absolutely. It's a lot of it is really figuring out the craft skills are skills that can be used over and over again, and they can be used in a multiple settings. They can be used with laundry and they can be used with substance use. And so because they're so applicable, it's really relevant for families to still stay engaged. And often, part of the work then is managing expectations and really continuing that positive communication, which can be very challenging because now there's still a lot of emotions, but they're all different emotions, or they feel different. They feel scarier. There's hope, but it's also balanced with fear. And so how do we communicate and keep that positive communication going so that they can continue to support their loved one through recovery?
I can say from the addiction psychiatry side of things, there's a big difference when family is able to be a supportive, positive mover of the needle in their recovery. It just helps them so much with recovery and it helps them make a difference to have that kind of support. I know a lot of the studies are based off of, an IP or someone with a substance use disorder is not interested in treatment. You're working with the family member. Do they have any scientific data behind what actually happens in the longer term? Like what are the outcomes past entering treatment if someone does craft?
Yeah, so we the Village received funding through the National Institute of Drug Abuse, or NIDA, to do a full-scale randomized control trial working with families. We had over 200 families go through a study that just wrapped up last year with our online component and specifically working with people impacted by opiates. Can we mimic those findings? And we did. So we had 69% of people enter treatment or enter a new form of treatment over the course of the 6-month study, which is wonderful. It's exactly what we hope to see. And we saw an 87% rate of retention in treatment at the 3-month follow-up post. And then at the 6-month, it was still 80% retention rate for individuals whose loved ones went through.
That, is dramatic. I don't know if there's that many things within psychiatry or substance use that have those kind of effects. So huge impact. 70% entering treatment and 80 some percent staying for 6 months.
Yeah, 80% at 6 months and 87 at 3.
So we really need to get the word out. People need to know about craft. Where can people learn about you as someone who does offer craft?
Yeah, so our main website is wethevillage.co. And they have a list for all of our programs. I meet with people all the time that are interested in craft. So on our website, there's actually a link to add time to my calendar to do an introduction call. You don't have to sign up for a program to do that. So I love to talk to people about craft. So I'm always available to do that. We on Instagram at We the Village, and people can sign up and explore the platform a little bit. They can see the first lesson and really get a sense of what it is that we do, which I think is just really useful because, you just don't know what you're getting into. And we want to make sure that people feel like this is a good fit. We want to learn more about craft and we want to continue.
You guys are nationwide, so they don't need to be in a specific state. Anywhere in the U.S. they can reach out to and work with you.
We start our small group programs. They start on a recurring basis, and we really try and base them on group members' availabilities. So We do a lot of evening appointments and evening groups so that we can meet people where they're at and get them when it's convenient for them. And yeah, we're anywhere that craft is interested. The other thing that I will say too is if there's any professionals that are interested in learning more, we partnered with Dr. Robert Myers, who created Craft, and we brought his previously in-person training for clinicians available online. And so you can hear through our professional training program, you can hear Dr. Myers talk about his personal connection to Craft, how it started, and his really recommendations for how to implement it well. And he talks about fidelity and the research base. This is a really unique offering because it historically was an in-person workshop. And we're really excited to be the only online platform where you can learn from Bob himself and hear in his words, which is just such a gift. It's so rare that you're able to do that.
So your website, wethevillage.co, and you can learn for people who are interested in self-study, groups, or individual craft nationwide, as well as any sort of therapists or people who are professionals and want to learn how to do craft effectively.
Yeah, absolutely.
Awesome. Do you have, for people who are like, I have insurance, I need to use my insurance, how do I know if my therapist is craft certified or trained to do this kind of work?
Actually, so Dr. Myers on his website has a list of craft certified clinicians based by state. And so can't guarantee that they accept insurance, but when we talk about there is craft training and then there's craft certification. And really the big distinction there is if a clinician has that they're certified and if they're listed on Dr. Myers' website, it means that they've gone through kind of a rigorous process to ensure that they're doing craft to fidelity. So they've had to submit recordings of actual client sessions. They've been scored, they've received feedback, and they've demonstrated that they're able to do each of the 9 core craft procedures to proficiency. So that would be a place to check out a list of all the craft certified clinicians. There are international locations available on his website as well.
Okay. Very cool. In case we reach outside of the US. And I think it's important for the audience to recognize that someone as a therapist, they may have familiarity with any modality, but like what you're talking about, where someone's been trained to fidelity to provide that, that's where they're going to get those really striking, 70% entry in treatment. Those big statistics that we're talking about are people that really have the good training to do it.
That's all of the research that's been done to show those success rates have been done with craft certified clinicians. So that is a distinction that is important. And I think it also just shows that they've been willing to receive the coaching and mentoring for this work, which enables them to really be able to brainstorm it and take this protocol and make it work for their clients.
Awesome. Ending and wrapping up this episode of Conversations with AcroPsych, I really want to thank Angie coming on today, taking the time to really teach us about craft therapy, how it can help you or other people who have a loved one, someone in their life with an active substance use disorder. So please share it with anyone that can benefit from them, and we'll see you next time. Thank you for listening to this episode of Conversations with AcroPsych. I'm your host, Dr. Matt Campbell, and I specialize in psychiatry and addictions. If you have questions about psychiatry or addictions, I host a regular Q&A for therapists, providers, and the general public. You can find more information about us at www.acropsych.com or on all major social media platforms at AcroPsych. We kindly ask you to subscribe to this channel on YouTube or rate us 5 stars on Spotify, since it helps expand our reach and inspire more of our audience.
This episode and all material is purely for general education and not personal medical advice. It does not establish a doctor-patient relationship, and we recommend you working with the appropriate physician or other healthcare provider before applying it to your situation.